Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina. My clinic is Hickory Spine, and today I want to talk to you about non-steroidal anti-inflammatory medications and their impact on joint pain and the body's ability to heal. Okay, so a lot of people use over-the-counter anti-inflammatories, and almost all of you, if you're watching me here, you know that there are some serious potential consequences to this. It can thin your stomach lining, it can cause ulcers, and a lot of people die from these medications every single year. And if you don't know that, all you have to do is go to Google, Dr. Google, and type in NSAIDS, NASIDS, deaths, yearly, and you'll get probably the 2016 or 15 statistics. And the important thing to understand here is that these medications are not to be taken lightly. If you have joint pain or if you've been injured and you're taking these NSAIDs, I'm not saying that you shouldn't take them or you can't take them, but what I am going to tell you is that they inhibit and they interfere with the healing process. They inhibit and they interfere with your body's ability to heal. So when you take them, it interferes with the inflammatory process, which is a normal part of healing. So I understand, not having pain is a really important thing. I'm not minimizing that, but what I want you to understand is that there are a lot of risks that are associated with it. And there's a lot of things that you can do nutritionally to help you decrease pain, okay? So when you look at this, there's a lot of risk to the NSAIDs. There are a lot of things that you can do nutritionally. Stop eating, eat a diet that's more whole foods, more vegetables, lean meats. Try to get organic if you can, grass-fed, grass-finished, free-range chickens, that kind of stuff. More vegetables, more meats, not necessarily lean meats, but just good meats that are grass-fed, grass-finished. So if you're buying your beef from the grocery store, that's not grass-fed, grass-finished. It might be grass-fed, the cows are raised in the pasture, then they bring them in and they corral them, so they can't move much, and they feed them soybeans and corn. That causes the cow to have very high omega-6 fats. It makes it an obese, sick animal. And guess what happens when you eat the beef from that cow? You become an obese, sick animal, and you may get exposed to antibiotic residues. I don't know if you know this, but the majority of the antibiotics used in this country are used in the livestock. It's used with these animals that they corral together. They get all these diseases and they just load the antibiotics in. So you might get antibiotic residue. You might get passed on from the grains and the foods that they feed them. If they're heavily sprayed crops with pesticides and herbicides, well, then the animals have them in their tissues. You eat them, especially if you eat the fat of the animal, you take on those chemicals. So grass-fed means they're raised in the pasture. They eat grass, which is their natural diet, cow's natural diet. Grass-finished means they don't corral them to make them obese, right? So that they weigh more and they can get more for them at the slaughter. They actually grass finish them, which they have a completely different fat profile. They have higher omega-3s. The cow's actually like a superfood. You understand? That's really, really important to understand. So when you just look at, for example, the food that we eat, if you're getting a lot of foods that have high pesticides and herbicides, you're going to have a greater likelihood of having an inflammatory process, building up toxic chemicals in your body. If you eat animals that are conventionally raised. I mean, have you seen these confined feeding operations? Have you seen the movie like Food Inc., for example? If you haven't, Google Food Inc. and watch it. But you might want to, use discretion with children, okay? Watch it and then preview it yourself. It's really horrific the way that we raise animals. And you've got to look at our food supply, and you wonder why we're all getting sick? Well, take a look at our food supply. Take a look at what we're doing to our food, okay? The Franken foods that are now being raised and made. Okay, it's unbelievable. So you got to look at your diet, and then the next thing is, if you're really as a way to help decrease inflammation naturally, you can use tons of different nutritional supplements, which are basically what derived from food. All right, so you use fish oils high in, if you're trying to decrease inflammation, EPA. Right, higher in EPA. That's more anti-inflammatory versus DHA, which is better for the brain. Then you would focus on something like maybe trying some turmeric and resveratrol in combination in a liposomal delivery. So it's in a liquid, so it's highly absorbable. And trying that's a very powerful anti-inflammatory. Making sure you have high normal vitamin D levels. These are all things that, in similar cases I've worked with people, and these are recommendations that I might give them. This is not for you because I don't know you as an individual, but these are things to think about. Curcumin, which is the active ingredient in turmeric, and resveratrol, like I said, vitamin D, and you know, a good, make sure you're getting adequate omega-3 fatty acids in your diet, which tend to be very anti-inflammatory. And then beyond that, just eating really more of, plants, less grains as a whole, grass-fed, grass-finished beef, organic as much as you can, right? Lower your burden of a lot of these chemicals. So these are really important things, because when people hurt and they have pain and they are like, I hurt all the time, and they think that it's something like they have to take something to, like, that's a powerful, like, let's just say an NSAID, like an over-the-counter NSAIDs. They take these things and they cause ulcers and all kinds of other problems for them. When if they would start with diet, or they would use that in combination, like diet in combination with maybe a therapeutic approach to help improve their function and decrease their pain, they may make huge, huge differences. That's what we do with people every day. That's how we approach back problems, knee problems, really anyone. We want to consider the whole person. What is going on with you? If you come in and your back hurts, well, why does your back hurt? Well, if you injured it, okay. If you're having chronic pain, prolonged pain, why do you have chronic pain? Right? I guarantee you, so many people are deficient in basic nutrients that they can't carry out normal chemistry. So this is really important when you're looking at joint pain. And this is how we approach things in our office. If you'd like my opinion on your case, I'd be happy to take a look at it. If you have questions or you'd like to learn more about my office, just go to hickoryspine.com and you can learn a lot more about what we do and how we approach things. But I hope this helps you to better understand joint pain and how diet and nutritional supplementation may be beneficial. If you'd like my opinion on your case, I'd be happy to help you out if I can. Our phone number is 828-324-0800. And I hope this helped you out today, and I hope you have a wonderful day. Thanks.